So we'll get started and really focus on different types of lung cancer surgery. But before surgery, there are some considerations. And one is that uh, we want folks to be able to do well after surgery. And in order to do so, it's really important to pay attention to lung function, to heart function, to how uh, active a patient is. And that is so that after surgery, we generally want patients up and walking 3 times a day, the day after surgery, sometimes even the day of surgery, so that they could take deep breaths and feel comfortable and not have pneumonia and other complications afterwards. So that's a really big uh, consideration. And then in terms of, we always want to make sure for early stage lung cancers, to still do a thorough workup and check to see if there's any disease in other parts of the body so that we don't put a patient through unnecessary operation. I think it's really exciting that early stage lung cancer is curable. These are survival curves from the International Association for the Study of Lung Cancer, looking at how well people do after surgery. And if you look at these 3 columns here, first, which is the earliest stage lung cancer, which in the era of lung cancer screening and more CT scans detected, uh, and more CT scans being given to folks for different kinds of workup and earlier detection of lung cancer, there's a lot more people with earliest stage lung cancer. And you could see that the 5-year survival rate is phenomenal. It's 80 to 90%, meaning that if you look at 100 people, 80 to 90 people with early stage lung cancer will still be alive after 5 years after surgery. These are the different types of lung cancer resection. So a wedge resection is where you only take out a slice of the lung. I've heard it be described as taking a bite out of an orange, so to speak. And segmental resection is when you take more of the lung and you really focus on dissecting out the artery, vein, and the bronchus, and it's what we call an anatomic lung resection. And the analogy, I've also heard it, the analogy I've heard being used is, it's like if you look at an orange, you're taking a full slice of the lung. So not just a bite out of the lung, but actually a full slice. So something that makes anatomic sense and is a full compartment. And then lobectomy is where so everybody has 3 lobes on the right side. So the lung is split into 3 lobes on the right side and then 2 on the left. And a lobectomy is when you take out an entire lobe of the lung. So diving a little bit deeper into the different lobes. So this is the right upper lobe in purple on this, where my cursor is, and then the middle lobe and the lower lobe. The middle lobe is the smallest of the lobes, and then the left upper lobe and the left lower lobe are on the left side. And then this is split further into these different segments, as we were talking about earlier. So sometimes, if, for example, if a patient has a tumor right here at the tip, you could just take out the part in the green as opposed to taking out the entire lobe. And likewise, I practice what are called complex anatomic lung resection. So it is hard, for example, to just take out level 7. It's hard to just take out segment 7 or just segment 8. But that's something that our field is trying to do in light of smaller and smaller lung cancers.